Your response to these questions can either directly or indirectly command the direction of your questions. So you know how after nursing school we are told nurses don't look for jobs, the labor market is filled with opportunities for nurses, blah 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 blah. I'll say there's little truth in that, and there's kind of, I won't use the word lies, I'll say exaggerated, because I am here to tell you that after nursing school I went to look for jobs. I attended quite a number of interviews, and I won't say I was disappointed by some of the outcome. I'll say I spent a lot of time fantasizing on the kind of job I am supposed to have, instead of focusing on, preparing for the labor market. And by labor market I mean preparing CVs, attending job interviews, what to expect during job interviews. So your CV is now ready, submitted. For some hospitals you have to sit for exams, you're called upon for interview. That's where the magic happens. That's what determines if you get that job or not, in most cases, if I'm being very honest with you, in most cases. So let's just give it to the 1% of the 1%, because a good number of times whatever you say, however they perceive you during that job interview, determines the outcome of getting that particular nursing job. So I'll be sharing with you guys how your response to a simple question such as "tell me about yourself" in a nursing interview can actually ruin your chances of getting that particular job. So this is going to be with regard to my story. Just to make this a little interesting, we'll be pinpointing mistakes and tips on how to do better. So if this looks like something you're mostly interested in, please do stay with me. So before I continue, Anastasia Obilo here as always, and let's just get into it. So I've shared on this channel a good number of times how my first job was in a closely knitted hospital, and yes, guilty as charged. I didn't have to attend any job interview. It was a thing of bring your CV. Maybe he had a little of, somebody that knows somebody that knows somebody that knows somebody. Maybe he had a little bit of that. And to be honest, my first job was mainly learning, unlearning as well. And I worked there for a year. Then I moved to a different city, now where the business happens. Now I can proudly say that I have a year experience as of then. So I applied for this particular job. So it was practically my first time attending a job interview, a nursing job interview. So fast forward to the job opening. It was actually supposed to be in an accident and emergency unit. I had submitted my CV. I could proudly put 1 year working experience at that point. And thankfully I was called in for a job interview. I was called in for that interview, and that was when I realized that it was about to go down. And I guess I got so comfortable because in my first job I felt okay, I didn't have to sit for any job interview. So I guess that did not condition my mind towards actually carefully preparing for my job interview, what to expect. And honestly, I couldn't find videos like this to guide me through nursing interviews. It was more of that general thing. So I just felt they're obviously going to ask me the basics. They could ask me anything that has to do with anatomy or whatnot, those basic things you can get at the tip of your fingers. So that was my expectation of job interview and what it could be like. Every other thing they need will be in my CV. Your girl had to be surprised. Your girl had to be shocked. I could have sworn I was overly confident going for that job interview, not until I stepped into the hall. It was more like a hall, but towards the end of the hall there was now like a round table. The staffs were there, and the main person to conduct the interview for me, but there were about 4 then. Then the anxiety started to creep in. I could feel my palms sweating for no reason. My brother, my sister, That was mistake number one, opening the door for anxiety, opening the door for uneasiness. And to be honest, this is not said enough. You have no business being overly anxious going for a job interview. So I sat down, and the first question I was asked after he looked at my CV was, tell me about yourself. I started to rush, and you know when you're already anxious, you're like, okay, this is very easy, thank God. So I started off with my name, introduced myself properly. It was going on well. Where I was from, I mentioned that I was raised in the north, and then they were like, oh, I bet you could speak Hausa very fluently now. I was like, yes, I try. Then they were like, no, don't say you try. You've been in the north all your life. There's no way you cannot say you cannot have a proper conversation in Hausa language. That became like a conversation, little chit chat and all that. At this point, I was getting a little relaxed. Then I mentioned my school to experience where I had worked. So when I was talking about how long I had worked with regards experience, that now spring further questions. And let me just add that, be rest assured that your response to these questions can either directly or indirectly command the direction of your questions. I had to learn the hard way. You're not going to a job interview with the intention to, overly hype yourself, state experience you have and do not have. Be sure that if you're going to overhype yourself, or if you're going to hype yourself at all, or state experiences that you have, be sure that you have evidence to back it up. And by evidence, I mean both knowledgeable evidence and also paper-wise evidence. Know this and no peace. Know this and no peace. I made this mistake, so you don't have to make this mistake. So back to our story. So while it was going on like a conversation, the next question that popped in, remember how I directed the pattern of these questions? So while we're going on, so the next thing was, okay, what unit did you work in this said hospital? And then I said accident and emergency units. Let us go back. Remember when I said I had worked in a closely knitted hospital? That is to say, our hospital was such that every Dick and Harry comes to the reception first. Like, you come to the reception, there's no go to that unit, that's where they handle this, go to this unit. Everyone comes. The only nurse you meet, the nurse you meet on duty is the nurse that will attend to you, whatever issue you have. I don't know if I'm making sense. So you know how a closely knitted private hospital, what it looks like. So that was where I walked in. So I was just so quick to say, oh, A&E. I just felt maybe they won't take the hospital I had worked in so seriously if I just said it was a closely knitted hospital. You just had to come to the reception. Or I to be honest, I really didn't know how to put it. I really did not know how to put it. And remember, I was already overly anxious. So I quickly just said A&E. And they were like, oh, beautiful. This was the man's expression. Oh, beautiful. That makes it even better. And I'm like, okay, that's fine. I'll just tell him what's the worst that can happen. He will ask me the cases that is being handled in accident and emergency units. And of course, I have knowledge of that. And I'll just tell him the basics. And went on to say, what are the cases you've handled in your time of practice in accident and emergency units? Let's hear from you. Then I went ahead to say cases like injury from accident, emergency, bleeding from cuts, abdominal pain, severe pain, difficulty breathing, epileptic seizure. Then he asked me, oh, epileptic seizure, interesting. Remember how I said your response to some of these questions can directly or indirectly direct the pattern of your questions during a nursing job interview. So we have to be very careful. So what was the case like? How did you handle it? And let me be honest, I had as of then, I had not firsthand handled any case of epileptic seizure. I had not seen any patient. We only know it by the book. At that point, I only knew it by the book, what to do. Just knowledgeable kind of knowledge, not actually practice it. I had not done it in practice before. Then your sister went ahead to say, oh, he was a young man, so I just administered IV diazepam. And you should have seen how fast I went ahead to respond. Thanks to anxiety. He just looked at me and said, was that your nursing intervention? At what point did you ensure that the patient was turned to the side to prevent possibility of choking? What kind of clothing was he wearing? Was he loose clothing? Was it tight clothing? Did you ensure that the clothing was loosed? Did you even ensure that he was breathing, or you just administered injection in whatever state? His immediate surrounding, did you make efforts to prevent him from getting himself harmed? Was there support to his head? How long did the seizure last before coming to the hospital? Please note that, not that I didn't know the answer to this particular question, but my response obviously came from a place of anxiety. And in any job interview, please be rest assured that, especially for nursing job interviews, the target is towards your nursing interventions. Leave medical interventions for medical doctors. Leave medical interventions for as directed by the doctor or just later on. Your first target should be towards your nursing interventions. They are not the first thing. The first thing is, what is your nursing intervention? Before your girl could salvage the situation and say, oh yeah, I was going to say that, or oh yeah, I missed that. You know what, I want to. At this point, he was like, it's okay, it's fine. And you know what that kind of is okay, it's fine means. At this point, I had embarrassed myself, not only myself, my family at that point. So that was how I was never called back, and you guys know obviously why. So my 4 tips will be: 1, relax, but don't be relaxed, if you get what I mean. Be confident. As a nurse, you have no business being less confident, being in an unease, or being shaky, because especially in a place like accident and emergency, there are situations that you have to remain calm to handle such situations, which brings me to my second point. If you are asked, especially when it comes to scenario questions, please start with remain calm. I remain calm first. Calmly, I attended to this situation. Calmly, I remained calm first. Staying calm in situations is a big point first. Is a big point. That shows your level of confidence. That shows, that you know what is expected of you. Because you can't, if you're not calm, how can you arrest a situation? If you're not calm yourself, how can you tell the patient relatives to be calm? Or how can you advise them to please be calm? How can you even talk them into believing that everything is going to be okay? When you're not calm yourself, you're at an unease. They can sense fear. And a patient relative bringing their patient to you, they want to see that you're confident. They want to see that you're making them believe that everything will be fine. So as you appear, so you'll be addressed. Our number 3 point is, and I've mentioned it, it's your nursing interventions that they are interested in, especially with scenario questions, not medical interventions. Leave medical interventions for later. And our last tip, the last but not the least tip, is if you don't know the answer to a said question, please do not make the mistake of saying, no, I don't know it, sir. I don't know it, sir. Why not try the method of, turning the question around? Oh, I have not experienced this before, but if I was to meet a similar situation like this is how I will handle it. I have not seen this in my year of practice. I have not experienced this in my year of practice, but this is what I've experienced in my year of practice, and this is how I handled the situation. Do not make the mistake of saying, oh no, I don't know it. Let them not ask you the first one, you don't know it. The second one, you don't know it. Don't let the third one be, what do you now know? Find a way to direct the pattern of that question. Direct it to suit your favor in such a way that you had to say something. It's not actually the response to that particular question they might be looking for. The target might be to see how you respond to questions. Anyways, I hope you picked something from this video. You picked something from my little story time. I hope you pinpointed the mistakes I made, and I'm hoping you don't have to make similar mistake, because of course, hence why we are doing this video. Please let me know in the comment section if you want to see more contents like this, if you want to see more story time relatable content like this with regards to nursing, and also share with us in the comment section, what is that one question that made you flop in a nursing job interview? Share with us. Do not forget to like this video, subscribe, leave me a comment in the comment section. Let me know your thoughts. Share your thoughts with me in the comment section. Please, let's make it as interactive as possible. So thank you for watching. Thank you for sticking to this very moment. So until my next one, bye.